Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine Chiropractor. Let's talk about muscle weakness and how to strengthen it. I have been asked this question so many times, so stay tuned for the answer. Thanks for watching. So most of the times when people come to my practice with whatever postural issues or aches and pains, it's as a result of a weakness and lack of activity of a specific group of muscles that cause their issues. So a lot of times, for instance, they're slouched forward, which means the muscles are weak in the back and they're not able to pull it back. Now, the challenge is when people are hyperactive, they have hypertonic muscles. So they're, for instance, in a military posture or in this posture. So what do I do in those instances? I do the same exact thing I do with the other case, the opposite case of slouch forward in this example. In reality, calming the muscle down from spasm because they're hypertonic, military posture as an example, is much more difficult to treat than the opposite. But the treatment is the same. And the way I do it is I actually, after the examination, which involves brain-based neurology and posture, to map the brain with regards to the body parts and movements to see what area is weak, because if we can activate it, now the brain can give the command, so to speak. But I put the patient through developmental kinesiology. So building the barrel, which I've done a video on that, search for it under posture playlist, is essential. And really there's a lot of coaching and engaging. It's all, we call it cortical connection. So it's touch and tell when I have the patient do a specific move and hold the pose. And my role is to make sure that the right muscle is doing the pose. So regardless of that, that is the very beginning stage of strengthening the weak or calming the hypertonic. So to strengthen the weak, you don't go to the gym to strengthen it. There are preliminary steps necessary to get you to the point that now you can go to a gym and do the actual workout. If the area, the joint is improperly aligned, adding more load to it is simply going to do more damage in the future. So you have to understand the very basic concepts here. Put the joint in the proper alignment. Don't pay attention to the repetition, but the form. And you have to understand your brain is going to give you what you're asking it to do. So if you're asking for 2 sets of 12, it's going to give you 2 sets of 12, even though the muscle that is to do the 2 sets of 12 is tired. So it's going to borrow muscles from the surrounding tissue to finish and give you what you asked for. So what you asked for is not 2 sets of 12. It's 2 sets of 12 using the right muscles. How do you know? Well, just like everything else, you should search what you're working. When you're doing a workout, do a little preview of what it is you want to do. Why is it that you're doing it, and how to do it correctly. If you go on YouTube, there are so many videos posted on people doing different exercises, like for example, shoulder joint. But when I watch them, it's like, oh my gosh, if you continue doing this, you're going to hurt yourself. So be careful. And this is more of a video that essentially tells you how to prevent injuring yourself when you're working out. So if you have any questions, make sure you contact me and subscribe to my YouTube channel, and do know that I do care. So it doesn't matter if you're my patient or not. If you have a question, just shoot, ask me the question, and I will make sure to answer it. Anyway, thanks for watching. Take care.